Good morning. This is Dr. Tarek, continuing with phlebotomy certificate exam preparation. Question number 1 is, which of the following is not an anticoagulant? Sodium heparin, sodium citrate, thixotropic gel, addita. The answer is C, thixotropical gel. That is separator that separates the formed element from the plasma after centrifugation of the blood. The most common antiseptic used in routine venipuncture is options: povidone iodine solution, bleach, isopropyl alcohol, chlorhexidine gluconate. The answer is C. Isopropyl alcohol is the most commonly used antiseptic. How many times a needle may be used before discarding it? 1 time, 2 time, 3 time? No limit. Only 1 time. It is disposable. It is used only for 1 time. Which of the following indicates the largest size needle? Gauge 20, 23, 16, 21. 16 is the largest size needle. The rule is, bigger the number, smaller is the needle. Smaller the number, the larger is the needle. So here the smallest number is 16. So this is the larger needle. And blood bank use this needle, 16 number. The most common gauge used for a routine venipuncture or most common used needle is 16, 20, 25, 23. The answer is B. 20 is the most commonly used needle. Phlebotomy certification exam preparation, which is the first choice of puncture? Which vein is the first choice of puncture? Basilic vein, median vein, cephalic vein, iliac vein. The answer is median vein. Which vein lies close to the brachial artery? Options are cephalic artery or cephalic vein, median cubital vein, basilic vein or iliac vein. The answer is C, basilic vein. Next question, which is not a purpose of requisition: filling insurance claims, identifying the patient, determining the specimen to be collected, allowing the equipment necessary for the collection to be gathered. The answer is A, filling insurance claim. That is not a purpose of requisition form. Next, which vein is often the only one that can be palpated in an obese patient? Options: median vein, cephalic vein, basilic vein, and iliac vein. The answer is B, cephalic vein. Cephalic vein is the only one that is palpable in obese people. Next, upon entering a patient room, you should first do what? Assemble your equipment, put your gloves on, introduce yourself, identify the patient. The answer is C, introduce yourself, who you are and why have you come. At what angle should a venipuncture needle penetrate the skin? 10 to 15, 15 to 30, 30 to 40, 45 degree. The answer is B, 15 to 30 degree. Which information must match on the patient ID band and requisition form? Date of birth, physician name, ID number, patient name. The answer is C, ID number should match. Tourniquet should be placed dash inches above the venipuncture site. 1 to 2 inches, 2 to 3 inches, 3 to 4 inches, 4 to 5 inches. The answer is 3 to 4 inches. An increase in the ratio of formed element to the plasma is called what? Hemolysis, petechiae, Hemoconcentration, hematoma. The answer is C, hemoconcentration. Next, hematoma can be caused by removing the tourniquet after removing the needle, withdrawing the needle before removing the last tube, withdrawing the needle too quickly, removing the tourniquet before removing the needle. The answer is D, removing the tourniquet before removing the needle. Very important. During the venipuncture procedure, the tourniquet should stay on no longer than 30 seconds, 45 seconds, 1 minute, 2 minutes. The answer is C, 1 minute. You have to complete your job within 1 minute. Small red spots on the skin are referred to as hemolysis, petechiae, hemoconcentration, hematoma. The answer is petechiae. They are due to rupture of the small capillaries. An increase in the ratio of informed element to the plasma is called what? Hemolysis, petechiae, hemoconcentration, hematoma. The answer is hemoconcentration. Hematoma can be caused by, the answer is D, removing the tourniquet before removing the needle. If you are asked to perform a venipuncture on a patient who is not wearing an ID band, you should do what? Identify the patient by asking his or her name and perform the venipuncture. Ask the patient nurse to attach a new ID band. Ask, notify the patient, refuse to perform the venipuncture. Answer is B. Ask the patient, a patient nurse to attach a new ID. The following can occur if tourniquet is left on the patient too long. Nerve damage. Options: petechiae, occluded radial artery, hematoma. The answer is B, petechiae. During the venipuncture procedure, the tourniquet should stay on no longer than 30 seconds, 45 seconds, 1 minute, 2 minutes. The answer is C, 1 minute. This is all for today. Thank you. Have a good day.